Record this session. So thanks everybody again for coming to the COVID Task Force Campus Update. And we're just going to get started, and we're going to start first with COVID status updates in Maui County and Hawaii. I think we're going to have Denise. Are you starting us off?
Okay, can everybody hear me? Are you going to advance the slides, Laura? Okay, so the state of Hawaii statistics, we are seeing an uptick. It's the kind of the last dregs of Thanksgiving, we hope. So we had 57 cases yesterday, I believe. In the last 24 hours, our positivity rate is 2.4, so it's gone up a little bit. Our average, our 7-day average daily cases was 112, and our fatality rate is really good. It's 1.4, and that's kind of some of the most important. Here on Maui, we had, I want to say 11 or 12 reported today. No deaths. There was 2 deaths, one on Oahu and one on the Big Island. In the hospital, currently, we have about 4 cases in the hospital. So right now, considering that we're well past 2 weeks after Thanksgiving, we think we're in pretty good shape. Next slide. Okay, HIPAM is, I went to the HIPAM org. This is forecasting support. And actually, when you go to HIPAM, any of the faculty can sign up for this thing. They do the Hawaii Pandemic Applied Modeling. So basically what they're doing is looking at the models of worst case scenario and expected cases. Next slide.
And you know what? We actually also have Tom who can jump in to tell us a little bit more.
Tom, why don't you handle this part?
Sure. So the HIPAM came out of the Epi department at Manoa. I don't know, Eris, maybe you know Thomas Lee. He's so Thomas was like the lead modeler for HIEMA right when the pandemic happened, and everybody, the federal government said good luck states. And so Thomas and Victoria Fan set up a consortium for modelers. And that's what HIPAM kind of is. And they really open it to everybody. Debbie, she shows up every week. Jenny's come before, a bunch of my students. It's really great. And so I was asked to talk a little bit about modeling. And so I got a couple slides. I guess we're starting with California. So this is reported cases in California, just to give everybody a fear factor. I'm sure you see it on the news. They're all crying. You can see that curve going straight up. And geometric growth, it's kind of hard to stop it once you get past that inflection point. And then the deaths, follow a week or 2 later. And so anyways, that's, and for travel to Hawaii, California is like the biggest percentage. So if we had just one, and there's a whole slew of leading indicators, mobility, masking, all these things, but this is probably number 1. So I'd be scared, right? I think a lot of people are kind of concerned. You can flip the slide. And we'll look at state of Hawaii. I'm following Denise's lineup here. So this is reported cases for Hawaii. And you can see the bulges. And so, when we're modeling, what we try to do is decompose things that are going on, trends, seasonality, other things. We really don't have a lot of years of data, so we can't really look at seasonality. But what's pretty clear is holidays. We get a bump at holidays, right? And bumps are severely bad. And we're kind of, the HIPAM group's kind of shocked that we're seeing kind of a flat for the state here. It looks relatively flat. Obviously, Oahu's most of that. We would actually expect us to see more like California since we're getting travel, but it looks like the travel protocols are helping a bit. We can flip to next slide. And here's Maui.
Can I just add something real quick?
Absolutely.
I think one of the reasons why we're staying flat is not only because of the strict travel protocol that we've kept in place, but also people here are wearing their masks and really physically distancing. And I think we're seeing some good results of that. Even though we have climbed a little bit, this wasn't nearly what we thought we were going to get.
Yeah, absolutely. There's a, a link for all these things, mobility and masking. I think we're at 85% and we've been pretty consistent. Yeah, California's got some issues. But looks like if Maui has small data, we're looking at the Maui graph now, and it looks, I think Charlie was talking about this the other day with me, you can see a trend up there. And, small data, so we're hoping it's an artifact, but who knows, right? So it's kind of scary. We'll see what happens, but best thing is to stay home and mask up. And that's my 3 minutes. Mahalos.
Mahalo, Tom. I was wondering if maybe Denise and Angela could talk a little bit about, and Kathleen, for those of you who have been in the HIEMA meetings. I think you were sharing about Dr. Pang's kind of forecast of what we're really concerned in looking at versus hospitalizations and those other numbers and capacity.
Well, we're a small island, and we consist of 3 islands. Sorry, we're not just a small island. We're a county that consists of 3 small islands. Both Lanai and Molokai have very, very not very robust health services, and we have 1 acute care hospital. And so we're very conscientious that if this gets out of control, we don't have any resources that the mainland has. And frankly, when we had, back in August, when we had those 35 cases at Maui Memorial, we were able to call in flight nurses from the mainland. I'm looking at what's going on in the mainland everywhere, and there's no nurses to be had or excess staff to bring out to Hawaii. And so our mayor is quite conscientious of that and isn't afraid to really enforce the mask, wearing the mask, quarantine when necessary, and physically keeping 6 feet. And it really is helping. So when I look at, are the cases going up? Yes, we're seeing the cases going up, but more importantly, are the hospitalizations, what's happening with our healthcare? That's really where we have to be conscientious. Anyone else want to jump in?
No, I concur. One of the biggest things that a lot of the focus is on, which is expected, is the hospitalization rate, the ICU beds, the ventilators, and so forth. And exactly what Denise is saying, exponential growth of numbers is being seen in the mainland. Tourism is open. We don't want that for our islands. And so this is where we have to be vigilant and responsible for what we can do, and exactly what it is. It's the wearing the mask, the hygiene, social distancing, doing outdoor events, and being mindful of, if 14-day quarantine, if you're traveling, if there's travelers, being aware of that as well, because it's so viral.
So I guess when we're looking at all of these numbers, what we're hearing is to look at the hospitalizations, the ventilator rates, and then sort of anticipating these surges that Tom is kind of pointing out. So it gets so confusing, right? Which numbers do we look at? Okay. Anybody else comment?
I have a question about numbers, if I can ask. When I look at health.hawaii.gov, they have something called probable causes. It's the antigen positivities, and it's like a weekly number, and it's really high for Maui as opposed to others. It's like 217. So, I mean, how realistic are we being when we see that there are 9 cases on Maui when we are not tracking every positive case? Or can you shed some light on what I'm seeing with the probable cases on that website?
Yeah, so there's a multiplier between 2 and 10 for every reported case. There's between 2 and 10. And there was just a national study that came in at 7.1. So let's be conservative and say, if it says 15 reported today, there's really 150 running around. Does that help?
I just think it really leads to a false sense of security that don't feel like we're getting like the realistic numbers. So I just wanted to just think that I'm not just the only one that thinks this is crazy.
Ellen, we're not getting the realistic numbers, but the reason why we're looking at hospitalizations and use of hospital beds is because for 80% of those people, it's asymptomatic spread. It's not going to do a whole heck of a lot except spread the disease. It's that 20%, the really vulnerable population, that we're quite concerned about. And that's why we're watching the hospitalization rates in addition to our positivity rates, because you're absolutely right. They're not counting the antigen, or if they do, they're waiting until it's confirmed. But they may never be counted. And what Tom said about trying to figure out that if you've got 10 confirmed positives, what does that mean going on in the community? And I'm always doing multipliers like that. Like when I see our numbers, I'm going, well, is it times 10, times 7, whatever.
Okay, so I guess we're going to move on to the next part, which is, so what are we doing about it? So I think we'll start with Eris. Eris, do you want to tell us a little bit about the vaccination events?
Sure. Can everybody hear me okay? Because my mic is a little soft sometimes. But so we've been heavy into the vaccination distribution, or the pods as we also call it, coming up in the next, actually our first distribution should be sometime next week. For Maui campus, we're going to be the main distribution point for the first few months as we go through the different tiers. As I mentioned, the next slide also shows the different tiers. But the goal for us right now is constantly changing. As of this morning, Dr. Pang just sent an email to the whole team saying that we might also be distributing Pfizer now. We were actually looking to distribute the Moderna next week. The dates of operation as of right now, which is subject to change, is going to be the 23rd, 22nd, 23rd, and possibly the 26th, those 3 days. And this is what we call our closed pod. So it's only for select individuals listed here on the tier system. We're looking at 1A and 1B in particular. We're going to be covering everyone in this area, which includes some of the smaller clinics that are not covered under the hospital, Walgreens, or CVS. They're going to handle those specific areas. So our main goal is to deal with as many of the first responders here on island as possible. We're looking at to target anywhere between 2 to 400 cars a day within those 3 periods, 3 dates. And it's going to be ongoing until we can cover as many people as we can, until we get through all the different tier systems. We don't expect to start to distribute to the main population until much later in the year. Maybe I'm guessing, don't hold me to this, but possibly anywhere between after summer, August, September, possibly, will we start to do mass vaccinations for the entire county, which means everybody else. So the main focus right now for us is basically the first tiers of 1A and 1B, and try to get those as much as possible. And then of course, going down the tier from that point on. We are looking for as many volunteers as we can. We're looking to staff each vaccination clinic operating period with about 60 or more volunteers. And some of the requests we have are people to help with the monitoring. Registration is the big one. And of course, traffic control. If you have a medical background, or if you've done medical work, like Denise's staff and whatnot, they're also going to be participating with the monitoring and also vaccination. A lot of our nursing students will also be a part of this, which is great. They will be helping with either monitoring or vaccinations as well. So we definitely, it's gonna take a whole village, in this case, to run this clinic, and we require a lot of help and support along the way. But as many of you know, whether it's a Pfizer or Moderna, there's a two-prong approach. You get your first shot and then your booster anywhere between 21 to 28 days later, depending which one you're taking. The biggest difference between the two is that with the Pfizer, it requires to be under extreme temperatures. I believe it's -7, and we have one here, but most of it's going to be held probably at the hospital. But with the Moderna, it doesn't require, it can be held in a regular freezer type situation. But so we're hoping to be able to distribute the Moderna, and that's what we're hoping for. It's, I believe it may have already gotten the FDA approval, and we're looking to get our first shipment somewhere on the 20th or the 21st.
They don't, the FDA panel did approve it, but they don't, the EUA authorization won't be till tomorrow sometime
I see.
from the FDA. So
So in that case, we probably won't get our shipment until maybe the 22nd, which means our first day of operation most likely will be the 23rd. We have a 48-hour window to start distributing once we get it. That's why. So, and I don't think we're gonna be the team does not want to distribute on Christmas Eve or Christmas Day. So Dr. Pang says he wants to, but I didn't quite agree. So,
I think I was the only volunteer that would do it with them.
So as far as the vaccination goes, I just ask if anyone we'll be sending out a link. We have a meeting today, this afternoon, about the different links we're going to use to gather volunteers, because we're going to need to space them out from now until summer. And I'm not sure how often we're going to be doing it per month.
Eris, I just was in a meeting with DOH, so they'll be sending out a volunteer sign up link.
Perfect.
So the volunteer, if you want to volunteer, it'll be going through the Department of Health. They're going to be the lead agent. Is it Eris? I understand they're the lead agency.
Yes, they are the lead agency with the support of the county. They're the state agency. So they will be handling the volunteer list. So basically what is going to happen is you guys are going to sign up on this online form. We're going to have a list of names, and then we'll be calling you on the to let you know if you're available on certain days, because not everyone's going to be able to volunteer on the same day, obviously. But so that's how we're going to kind of work it, and it's going to be under the control of Department of Health. So you'll probably be getting a call from them. Also, I wanted to bring up that all volunteers will have an opportunity to also get vaccinated if you choose to do so. You don't have to have it. You can choose not to, but all volunteers will have the option of whether or not they want to get vaccinated. And we plan to vaccinate the volunteers prior to the event starting. And we're staggering them, of course. We're not getting everybody vaccinated at the same time. But so you have that option. Is that you don't have to wait till your turn on the allocation list, but you can get it when we have our vaccination distribution periods. That's pretty much the update I have. I'm heavy into the planning for this and for the rest of the county, so I'm kind of just breathing above water here. So if you have any other questions, by all means, please let me know.
Eris, I just have one. I have one question. As far as the sign up for the volunteers, I mean, I would like to volunteer and probably to be a vaccinator or oversee that, because I am a nursing instructor. Is there going to be different areas where you can sign up under, like different stations?
Constantina, PHN has made it very clear that the vaccination will be done by PHNs.
Okay.
So, like I said, Hawaii Department of Health is taking the lead on this. We are in support of them.
Correct.
Okay. So wherever, so once we volunteer, they'll just tell us where they need us.
Now, if you want to volunteer as a vaccinator, then you do sign up, and you need to let them know your credentials, and you have
Of course.
and you have to, I think you have to have a background check, Eris. I mean, I'm MRC, so I had to have a background check.
Yeah,
So
I'm
Angela,
MRC. I'm MRC as well.
I think Angela sent out the link, and maybe she can do so again after this meeting for people to sign up.
Okay, great. Thank
The
you.
link's not ready yet.
Yeah, it's going to be coming out soon. They redid
There's a new
Okay. It's a
initial
new
link.
link. Oh, okay.
The initial link
Yeah.
that was for volunteers for the practice exercise that we had Just earlier, I don't even know what day it is anymore. When we had our practice exercise, where we set up everything, we had our walkthrough. And again, I want to thank for any the volunteers that were helping us out that time and with the walkthrough, and the feedback we got from that was instrumental in us adjusting and making changes to hopefully make our distribution point in the near future much of a success. So thank you guys for that feedback on that. As far as volunteers are concerned, yes, public health nursing staff will be monitoring or actually taking the lead of vaccines, but that doesn't mean that we won't need more vaccines. I know that, for example, once we do mass vaccinations, we're going to be doing more, we're talking about thousands. So we're going to need as many vaccines at that point in time, because there's only about 15 or 12 PHN nurses, and there's no way we can cover it with that. So just keep in mind that we will need vaccines in the near future as well.
Mahalo. I think we're going to now cover some of the efficacy and safety questions that some people had with, and Kathleen, I think, is going to be taking us through this.
Yeah, so this is actually an infographic that one of our first-year nursing students put together to address some common questions about the COVID-19 vaccine. I think there's some concerns that it was a rushed process, but the technology actually isn't new, and there was a lot of political and economic will and collaboration that went into it. It did get emergency authorization because it met all of, at least the first one did, the Pfizer and the Moderna, and hopefully there'll be more behind that because they did meet the requirements that the federal government puts on those. So we're just seeing a couple different pieces of the infographic here. So this addresses how it works, if that's of interest to you. Side effects are those typical of vaccinations. Again, it's important to remind people that it's not that it's making you sick. It's not live, it can't give you COVID, but it's your immune system reacting. So if you do have side effects, it means your immune system is strong and building defenses against the virus. So it's actually can be interpreted as a good sign if you have those. And so that can be pain at the injection site, fatigue, headaches, chills, muscle and joint pain, but they're usually transient, 1 or 2 days, unlike when you actually are afflicted with the virus, when they can last much longer. So this addresses a little bit of the safety testing, the toxic ingredients. I think historically there's some concerns about vaccination. Thimerosal is a mercury byproduct that historically was in some vaccines that has been cleaned up for decades now. So it doesn't have preservatives that might be of concern. So they haven't studied children yet. So they're starting, of course, with adults, and they're looking at studies in younger people. So hopefully that will be approved later next year. There are no complete contraindications to the vaccine, but they're warning people who've had reactions to vaccines before to be cautious, and they should be monitored by their provider. So those are probably not people who would be good candidates for a mass vaccination clinic. They might need some more supervision. And it has been determined safe for pregnant women.
Kathleen, can I just add something here?
Of course.
Okay, so initially for the mass vaccination clinic that we were going to have, we did put children under age 16. Well, it turns out children 16 and older are approved for Pfizer only, and 18 and older for Moderna, and it's most likely that we'll be doing Moderna. That's it.
Okay.
I have just a quick question. So because there's different vaccines, is it that a facility has to kind of commit itself to one? So you won't be offering both the Pfizer and the Moderna, you make a choice between one or the other? Is that how that works?
What Dr. Pang is saying is that it looks like the hospital may be getting 900 extra doses. And so we may be doing one clinic will be offering Pfizer and then Moderna the rest, but we will not be offering them at the same time. It will be one or the other. And if you get the Pfizer, then the shot 21 days must be Pfizer. It can't be Moderna. If you get the Moderna 28 days later, you'll get the booster Moderna. Does that make sense?
It does. It just seems that anyone who gets vaccinated has to be given this information, right? So that they know what kind of a follow-up and where to go to get it. Yeah.
Yeah, that'll all be done. And there's going to be an online registration. Going back to pregnancy, I just want to share with you, and I've been having this discussion with Natalie. Okay, so for the pregnant women, the State Department actually said, the health department on Oahu said in a Zoom meeting that if you're pregnant, you want to get it, we'll give it to you. And Dr. Pang has said, made the decision that if you're pregnant, you can't get the vaccines for these clinics. And that's still standing. When I mentioned this to the Department of Health, they said that they will do whatever Dr. Pang says. So I just want you to be aware that there's a little bit of controversy there.
So they're being conservative at this point. Yeah.
Dr. Pang is definitely being conservative.
Okay. And so I think we addressed how many doses of the vaccine. It is 2 for both. The timing is a little bit different. And so, yeah, again, to the point that Leanna made, people do need to make sure that they're getting 2 of the same one. And at this point, it's sort of whatever shows up, right? Will be what we start with.
And then do you automatically put aside that second booster dose so that
Yes.
it's available and you don't run out?
Yeah, they're planning for that. Yeah, that's a really good question. Although one thing is,
they're going to put aside the booster dose.
The reassuring part is that a lot of the effect and efficacy does happen after the first one. So, it's not that you have to wait that full 3 weeks or 4 weeks. So you are getting a good deal of protection during that time, but to get the full benefit, it is important that people get both shots. And this last one, I think, is an important point. Getting the vaccination doesn't mean that you're free from all of the COVID precautions. It's not known exactly if you can still transmit it after you've had the vaccination. So the masking, social distancing, all those precautions are still in place, but there's definitely, an increase or decreased risk that you as an individual will contract the virus. Yeah.
Can I just add a quick something? And this is bragging, it's not on the slide. And for those who read the newspaper the day before yesterday, it was front page news. But the reason why we have vaccine, and I just heard that vaccine is at the hospital right now, is because of UHMC and Sally Irwin and the super cool freezers. It turns out we were the only ones in the county that had super cool freezers. Maui Memorial came over and borrowed one, and they are able to stock all the Pfizer vaccine if need be for Maui County. And so it's kind of thrilling that we're going to be part of this and we're instrumental. So we have to thank the administration like Laura and Kaheli and Louie for willing to share our equipment with Maui County, with Maui Memorial and Maui County.
Mahalo. I think Charlie's going to tell us a little bit about our return to campus plan.
Aloha, folks. Thanks for coming. And I also want to shout out to Eris and the crew that he is working with. All the folks that are part of his military staff are doing just an incredible job coordinating all of these pieces. And they're going to actually help us coordinate a mass testing for all folks coming back to campus for the spring. So we're going to have tentatively, we have testing dates for January 4th and 5th from 8 to 11 a.m. We're going to have all of the logistics worked out for you to sign up for that and come out and get tested for COVID. And this is for anybody that's on campus, but specifically we're looking to really encourage any faculty that are going to be offering face-to-face classes. We're also going to be offering this to all the students that are returning on campus. So it's a voluntary basis, but certainly if you've been traveling, that would be another high risk that you'd probably want to think. Even if you were tested coming back, you might want to consider testing on the 4th or the 5th just to make sure that you're clean and ready to go. And so we'll have more details on that. Probably an email will be shot out, and the Department of Health, Kahoho and Colleen have done a really great job giving us the capacity to do this. We're hoping to test as many as 300 or 400 people for the return to campus. So again, just be looking out for the email, and thanks again for for Eris and his group and the Department of Health for making this happen. Thanks, guys.
Okay, this is like old stuff from the slides that I presented way back in June. Can you believe we've been doing this since March? So basically, institutions of higher education, the decision tree, and what we need to be aware of. So if we confirm a person with COVID-19 is on campus, we have to assess the risks. I just want to say that thanks to things that we did in the beginning, for example, breaking students who had labs into pods and having them with one faculty, making sure that we really limited who came to campus or who needed to come to campus, opening up our doors and windows, really doing the ventilation. This had huge benefits because at the end of the semester, we only had 3 known COVID-19 cases, and we were able to not close the campus at all because we did put all of these mechanisms into action before. So I'm not going to go over that, except that we are going to continue to wear masks, we're going to continue to socially distance, and we're going to continue to coordinate with local health officials, hand washing and wiping down surfaces. It served us well fall semester, and I think as we do the vaccine rollout, it's going to continue to serve us well. Next slide. So safe practices over the holidays. We're heading into the holidays. So like for Thanksgiving, if you are going to go to a gathering, please make it outdoors. We have beautiful weather here. So, carport, outdoors, at the beach, and try to keep people 6 feet masked and 5 to 10 people max. Don't want crowded places, and we don't want close contact settings. You want to, if you're having guests over, talk to them ahead of time about the precautions everyone should be taking. Wear a mask, wear a mask, wear a mask. Keep 6 feet between people who don't live together, and if you can, 10 feet's better. Like I said, we can gather and eat outside. Have guests bring their own food rather than sharing dishes and utensils. And then frequently clean and disinfect items and surfaces touched by multiple people, such as doorknobs. Next slide. We're going to continue.
We have one question. Is the gathering of 10 or fewer still the law?
I think so.
On Oahu, it is. For Maui, it went down to 5.
Oh, it's down to 5?
Yeah. However, we'd like to say 10. We
Okay.
don't want to become like them. It's just better to err on the side of prevention and precaution. But yeah, the law is not 5. It's 10 for Maui. I'm sorry. It's 5 for Maui and it's 10 for Oahu.
I think Oahu's still on tier 2, so I think it's 5, isn't it?
You know, I'll go look it up right now and I'll confirm.
Thank you, because I get mixed up. That part they've changed, but it might be 5 across the state. And all, as you know, the mayor closed all the bars because it was the bar hopping behavior that was increasing our clusters, especially Lahaina side. So going forward into spring, distance learning as a prevention strategy, that's going to be our primary strategy. We're going to continue using Zoom. We're going to, when you bring the students onto campus, maintain those 6-foot spaces. Please encourage them to wear masks over the nose and chin. I don't know if you guys saw this, but the Speaker of the House for New Hampshire gave his acceptance speech with like this on December 2nd, and he died of COVID December 9th. So this is still an extremely serious disease. And if you're gonna wear a mask, might as well wear it right. And then, I don't know about placing physical barriers. It turns out mask wearing and keeping your distance is the most important thing. Next slide. We're going to continue, and Laura, correct me if I'm wrong, but I believe we're going to continue the option with stay home and self-isolate when appropriate. So if you have been diagnosed or potentially exposed to COVID-19, you should stay home. And I don't know if you guys saw the announcement, but Aloha Safe, the app that Hawaii developed, just went live for all the state. Lanai and Molokai were piloting it.
Hey, Laura, did you get a chance to put that in the slides? Otherwise, I can put it in the chat. I was going to talk about that.
Oh, I'm sorry,
Oh,
Kathleen.
it's okay. No, I'll just put it in. I didn't know if it ended up in the final slide set.
I put it in the chat.
Oh, it's there? Okay. There twice then.
Okay. So we're gonna continue to actively encourage students, faculty, and staff who are sick and have recently had close contact with a person to stay home. And just so you know, this is recommended just for first-degree contacts. So I'm just going to look at up here. So Laura's right next to me on the slide. So say Laura and I were working together over 15 minutes. It has to be 15 minutes of contact, cumulative over 24 hours. And she gets tested and then she tells me, or she actually reports to the Department of Health or gets notified, and she has the app. The Department of Health will give her a code. It will go up and boom, my phone will let me know that I've been possibly in close contact with somebody who is tested positive. There is no identifying identifying marks. I have to go into quarantine. Laura has to go into isolation. But the question that comes up for me is, does my husband have to go into quarantine? Well, if I stay in the guest bedroom with my own bathroom and wear a mask when I'm around him, no. So I would be a first-degree contact to Laura. My husband would be a second-degree contact, and then anybody that he's out working with would be a third-degree contact. They don't have to quarantine unless the household is so tight that you have no choice. Laura's husband and family would have to quarantine, but their coworkers or classmates would not. Does that make sense? Because that was the most common question this semester, of who had to quarantine. All right, another incident that happened on campus towards the end is one of the classrooms we had a lab in, and we got notified a couple of days later that one of the individuals tested positive. And what Department of Health said was that the only person who had to go into quarantine was the lab partner. And other people, because they were more than 6 feet, did not, and stayed masked at all times, did not have to. Any questions on that? Oh, and Angela just put up that Maui does allow 10 persons with physical distancing and masking. And outdoors, please.
Denise, should I skip ahead to the safe travels part?
Sure.
And while I'm doing that, I think there was a couple questions about is it the app?
Okay,
Oh,
Marilyn asked, sorry to be asking again, are the lab instructors and staff going to get vaccinated? At this point, only volunteers who are volunteering at the mass vaccination and who are not in the high risk groups, which are healthcare workers and people 65 and older who are in congregate settings such as Rosalani Place, Holly McClure. Those are the ones who get the vaccine first. All others will be eligible when probably after February is what Dr. Pang is saying. He's thinking he can get the high risk groups, the 1A, 1B, and 1C done by Valentine's Day, depending on how much vaccine we have.
So actually, before we move on to the safe travels, I think this is an important one because Denise, you've been our face to the point of contact. So do you want to share how this is going to change?
Well, Kathleen Hagen has been going to the COVID, she's part of the COVID task force, and she also trained as a contact tracer. And so she's going to be assisting with being the designated COVID-19 point of contact. In addition, we have an RN down here who's been actually doing all the COVID-19 testing. She's also going to be part of the vaccine effort. And she's also going to be helpful if you must notify. But I think how we're going to do it is if you call the clinic and have questions and they don't know the answer, they're probably going to refer them to Kathleen or the COVID task force. Did I get that wrong?
There is a question about vaccines from Cheryl asking how long the vaccine lasts. Is it needed annually like a flu vaccine?
We don't know the information for that yet. That's going to be continued to monitor. The COVID virus does not mutate like flu. So they're actually hoping that either maybe you'll need a booster in 5 years, or this might be a lifetime vaccine. But that's going to take years of studying the clinical trials 3 group that's currently going through. So good question, Cheryl. If you're volunteering but not able to do the vaccine, will you be allowed to volunteer? From Barbara? Yes, you will be allowed. You do not have to take the vaccine ever. You just have the option. Emily Major, how can someone from 1B group sign up for the vaccine? Hawaii Department of Health is working on that. I actually will be in a meeting pretty much all morning about the online registration form that's being rolled out. So they're still working on that right now. If they can't get that up and running, Dr. Peng's going to be, and his team will be handling that. Eris, do you know anything else? That's what I'm getting.
No, that's correct. We're waiting for the BAMs, but we don't know when that's going to be up and running. So that's basically how someone from the different tiers will be registering in there and indicating what tier group they belong to. And and there'll be some instructions on how to verify that as well, but it's not quite ready. I don't know. We're hoping it comes out soon because we're supposed to be registering people now. But in the meantime, it's basically we're looking to, for example, in the state for the county right now for the first responders and whatnot. What we've done is send out a not a survey but a questionnaire to everyone in the county or that's working in the specific areas as far as the first responders and whatnot, seeing if they want to take it because that's one of the first tiers. And then they're going to be doing the same thing for the smaller clinics as well, because that's also who we cover for our distribution and sending out this survey, seeing if they're willing to take it. But that question, as far as if you're in group 1B, if you're a high risk individual, that would be the BAMs. But as soon as we can get that up and running, we'll have more answers. And we meet on Friday again. So hopefully we can get more answers and then we can let the team or the group know after that meeting on Friday.
There's been a couple of questions on testing as well. I think testing is a really important part of our plan. So just a quick clarification, for January 4th and January 5th, anybody can sign up for that testing, especially those folks that are faculty, staff, and students, UHMC. We have lots of tests. I think we'll have the capacity to test anybody that wants to be tested. You just, when you see the email, just go ahead and register for that. And then secondly, maybe Denise and Kathleen, you can talk about our capacity to test ongoing for students and staff.
We do have ongoing ability to test. Like I said, we have an RN until the end of spring semester. She's being funded through a special funding account, and she's actually one of our RN graduates, has her RN license, and will be continuing school for her bachelor's degree through UH-Hilo. And under that status, she is allowed to work in the clinic as an intern. And she has been actually doing all the tests independently. So we have the capacity to actually run 4 and 5 tests easily daily and probably more. The limiting factor is that she's only going to be able to work 20 hours a week because that's all the funding that they have for her. So you'll have to call 984-3493 and set up an appointment. We're going to continue drive-by. She's going to get in her little, I call it the bunny suit, but every time I see her, I want to start singing It's a Marshmallow World because she looks like a little marshmallow. And she'll be getting the test, running it, and we'll have the results in 15 minutes. For folks who need a nucleic acid amplification, this will meet that need. So some of the schools, the private schools especially, are requiring that before you can go on campus. Any questions on that?
You know, I put a link in for the new FDA rapid test too that has a high sensitivity and high specificity. I think it just came out this week or last week, which is phenomenal. You could take it at home.
Yeah, the issue I have with that is the expense. At $30 a test, that's a lot.
How much is the PCR? Is that like, I mean, no, we don't pay, but we pay.
You pay. At $130 is what Clinical Labs is charging.
Yeah, so 30 seemed like pretty good for the above 90% sensitivity specificity, right?
It is, but the thing is with this testing is we want to be able to do it frequently. So say we want somebody to do it daily at $30 a day, that racks up. And that's the frustrating part, is we want a cheap test that's that accurate that people can do at home. It's the cheap part we need.
Yeah, boy, I'm just happy about the sensitivity and specificity, but I'll keep dreaming on the cheap side.
Okay, I think the last part we were going to go over, unless there are more questions, was the safe travels. I can't remember now who was, I think was that Denise or Kathleen?
If it's me, I'll do it. It's a hot mess. Okay, so I have tried to get this clinic set up as safe travels for just even inter-island and or even just between campuses. And I've been met with bureaucracy that I can't believe. And the frustrating part about safe travels is that if you travel to the mainland, you still have to get a test at a pre-approved place somewhere on the mainland, such as CVS or Walgreens. The problem with CVS and Walgreens is they put up on their website that if you're planning to travel to Hawaii, they won't guarantee that if you take the test, you'll have the results in 72 hours. So what happened is initially when this opened, people would get the test, they would show it, and they would get on the plane, they would show it, and they would basically say, well, if you get the results, you only have to be in quarantine until you get the results, and then you can upload it and you're free of quarantine. Now that's changed. The governor changed that if you don't have your test results by the time you land, then you've got to go into a mandatory 14-day quarantine. Traveling inter-counties is the same thing, and I don't know if they'll accept me or not. I mean, we certainly have the NAAT testing, so we have the right test. I don't know if you can carry a hard copy and show it to people if that means anything, but it is frustrating that we can't even get approved for inter-islands, and I hope that changes.
I think there's discussions that's about to change. I think UHERO came out pretty hard on, the economy problem with that, and I think they're doing a secondary test here, a quick test, yeah. So
I can act as a secondary test. So if somebody's requiring a secondary test before you can go back, I do have the capability of doing that, and they will recognize that our form as valid. And I think there's going to be, because I'm not the only one that's hammering on this, there's a whole lot of physicians throughout the state that have the capability of running the correct test, and they're very frustrated that they can't test their patients and it be recognized by the state. So, but until then, we still have to follow this. Now, a lot of the private schools on Maui are requiring a test 3 days after you land. And we can't enforce it. We're a public institution, but if you would feel better, say you're on the mainland for Christmas and you arrive back and you have your negative test, but where you were in California where it's just out of control. Before you come on campus, if you want to take a test, we'll be happy to do it for you. Does that help? Anybody want to add to the safe travel quick facts?
I just want to say that the governor just came out with a change in the law today, reducing it according to CDC guidelines to 10. University of Hawaii, we're just waiting for UH to adopt and declare it down the pipe to us, but I know CDC did the change. The governor has just sent out a proclamation today, and the Department of Health and Maui has today sent something as well. So, but we're still waiting, but I just wanted to share that.
I think there was one question in the comments. When the positive numbers are reported for each island, 113 on Oahu reported today, 7 on Maui reported today. Do these numbers include both visitors and residents or just residents?
Just residents.
Okay, good question.
Does not include visitors.
Actually, okay, if the visitor was tested on the mainland, it doesn't continue, it doesn't have those results. But if they do get tested in Hawaii, they are included in Hawaii stats. So the frustration for us and for the Department of Health is we kind of know that our cases are being driven by visitors, but we don't have the data to support that because the visitors may be getting tested on the mainland and may choose not to test here, or they may not even know that they have it.
The only time a visitor is number is, it will be included if they are tested and it's positive. But there's a lot of times.
It has to be here, Angela.
Yes.
Tested here, but we
Tested
can't.
here because they've gotten sick is what Dr. Pang said.
Yeah.
Because I asked the same question to him.
And the thing is we've had people who took the test and landed positive on Maui. And
They can't go anywhere. They need to quarantine for 14 days.
Yeah, they have a trailer at the airport, but we can't count those numbers as our stats.
There's usually a footnote at HIEMA's website as well as DOH. They're a little bit different, right? HIEMA includes out of state where DOH doesn't because we're using that data for modeling.
When we include out of state data, we are counting Hawaii residents who tested positive while they were on the mainland.
Yeah, that doesn't help us for spread here. So HIPAM's doing modeling. We're using DOH data, which doesn't include that. So there's a little footnote for each website as to what's included, what's not. And Janet Berryman from DOH on Kauai, she's part of our team. And she was very clear about, because our modeling team was thinking the same thing as you, right? That travelers were spreading disease, but it's more, if you think about it, it's us that travels and comes back and gets into our close knit families that really are super spreading, not tourists so much. It was kind of informative if Janet shared that information, right? Because they don't share a lot of information. DOH is kind of secret personal information, right? HIPAA.
Well, mahalo, everybody. So just to reiterate, the vaccination is not required. The testing is not required, but we're just so grateful for the opportunity. Everybody does have access to both volunteering and then as a byproduct, get the vaccine if they choose, as well as access to the testing that early January week. So we're gonna send out more information. It is 2 o'clock, so we're at our time. Thank you very much. And if you have any questions, feel free to email any of the wonderful, I feel like we had panelists today, so thank you. Aloha,
Have a
everybody.
good day.